and welcome to the AUSON YouTube channel. My name is Vonnie Stone and I'm a nurse practitioner student at Auburn University. Today I have two special guests joining me to discuss what is a nurse practitioner. First, let me introduce my guests. First, I have retired educator Mrs. Etta McAfee. Please say hello.
Hello.
And my second guest is business owner of Tenny Songs Entertainment, Mrs. Tenny Delaney. Say hello.
Hello.
Thank you so much, ladies, for joining us today. Now I'm going to ask each of our guests 10 questions. I'll ask each question and they'll both answer it together at the same time. Or not at the same time, but they'll take turns answering it. All right, here we go. My first question is to Mrs. McAfee. What is a nurse practitioner?
Sort of explains itself. A person, a nurse, who's fully accredited as a nurse, who practices medicine, but practices it with an air to comfort, knowledge, with the patient in best interest of the patient in mind.
Okay, thank you. Mrs. Delaney, same question. What do you think a nurse practitioner is?
Well, I believe that a nurse practitioner works closely with the doctor and is able to answer questions pretty much like the doctor.
Awesome job, ladies. The next question is, what can a nurse practitioner do specifically? Mrs. McAfee, we'll go back to you first.
A nurse practitioner, for the most part, can do exams and also can, because of their certification, write prescriptions and look well after the care of their patients.
Mrs. Delaney, what do you think a nurse practitioner can do?
I believe they can answer calls if the doctor's unavailable. They can submit the prescriptions and further care.
Excellent. These ladies know their stuff. The next question is, can a nurse practitioner diagnose illnesses? Mrs. McAfee?
I'm not absolutely certain about that, but they can make observations because of their training and consult with a doctor or a physician, and they can come to some conclusion about the situation.
All right, same question, Mrs. Delaney.
I have to agree with Ms. McAfee. I'm not too sure.
That's okay. That's okay. We are here to educate you today on what a nurse practitioner is, but we just want to kind of see what your knowledge of them is right now. Next question, Mrs. McAfee, goes to you. Can a nurse practitioner manage chronic and acute illnesses?
I'm not sure they can do assessments and refer that information to the actual doctor in charge. My experience is that they do physicals and can write, as I said, write prescriptions and do evaluations in labs and things of that nature. But as far as getting into the complexities of individual conditions, I'm not sure about that.
Okay, and Mrs. Delaney, what about you?
I have to agree. I guess depending on the doctor, on the nurse practitioner skills, they get pretty close. Experience, yeah.
All right, good job, ladies. My next question is, do you think a nurse practitioner has to collaborate with a physician?
My experience has been that they do. For example, they'll do the exam, they will do the checkup and write the data and then consult with their physician with whom they work.
Okay, and what about you, Mrs.
My
Delaney?
experience is that they have consulted together and come to a final decision on some things.
All right, awesome. These ladies have already had experiences with nurse practitioners. That is awesome. My next question is, can a nurse practitioner order diagnostic tests like labs and x-rays?
My experience is they can do the labs and interpret and consult with their doctor. I'm not sure about whether or not over the course of time and their experience they can do that.
Okay.
I'm not too sure about that one.
All right, that is totally fine. My next question is, can nurse practitioners do simple office procedures?
I'm not sure about that. I know that they do the lab works, they do the physicals, my experience has been that they do physicals and then they turn that information over to the doctor then makes the final call on it.
Okay.
Well, I've had some experiences where they have performed some procedures with some minor.
Okay. Awesome. Awesome. I have a couple questions left. My next question is, can a nurse practitioner write prescriptions or prescribe narcotics?
I'm not sure about the narcotics, but I do know that they are able to prescribe medication. But it's, I wouldn't want anyone, except the doctor giving me a narcotic.
Right, so I would have to agree.
Okay, and my last question, but not least, is can a nurse practitioner bill for their services?
If they have their own facility, where they are the primary individual in that facility, I believe they can.
Yeah, I believe so.
All right, good job, ladies. That's all 10 questions. I have actually created a flyer that will help answer a lot of the questions that you were not sure about. Give me 1 second and I'll turn this around. All right, this flyer is entitled, What is a Nurse Practitioner? And you basically knew the answer to this one, but more specifically, a nurse practitioner is a registered nurse who has received an advanced degree, national certification, and specializes in areas such as pediatrics, geriatrics, family, and women's health. Nurse practitioners are skilled in the assessment, diagnosis, and treatment of patients across the lifespan. What can a nurse practitioner do? We've asked already. They can perform examinations, just like you said, treat patients, prescribe medications and narcotics. They can serve as a patient's designated primary care provider, and their fees are covered by most private insurances as well as Medicare and Medicaid. Moving on down. Give me 1 second here. There we go. All right, the next question I asked was, can a nurse practitioner take care of a patient's chronic or acute illnesses? Nurse practitioners provide health risk evaluations across the lifespan. They provide preventative care across the lifespan, mental health treatment and counseling, women's health care, pre- and postnatal care, health education, wellness promotion. They can also provide referrals to other healthcare specialists. I totally forgot a question. There was one final question I accidentally did not ask our two guests, and I want to go ahead and ask that now. Can you please tell me what you think the difference is between a nurse practitioner and a physician assistant?
That's a good question. Seems to me that nurse practitioners are often physician's assistants. Now, as for anything more detailed than that, I'm not sure.
Well, I'm going to tell you in just a moment. And what do you think the difference between a nurse practitioner and a physician assistant is?
A physician assistant. I'm thinking that a physician assistant does the prep and get the tools and things of that nature.
Sometimes they do. Sometimes they do.
Okay. And then that's as far as I'm going to go.
All right. Well, I'll go into that in a little more detail, but I did want to make sure I got that question in there. So another one of my questions was, can nurse practitioners prescribe medications and narcotics? And nurse practitioners can write prescriptions for both medications and narcotics according to each state's Nurse Practice Act, which typically gives them prescriptive authority through written agreements with their collaborating physicians. A DEA, Drug Enforcement Agency number, is required to prescribe narcotics after that nurse practitioner has practiced for at least 1 year and has attended a special course and paid a special fee. As far as why would you choose a nurse practitioner as your primary care provider, nurse practitioners as a primary care provider can focus on health promotion, education, disease prevention across the lifespan. They have advanced skills in assessment, diagnosis, treatment of illnesses. They They can order massage therapy, physical therapy, and other rehabilitation therapies. They can explain specific details of their patient's health problems, medications, and other topics to help them understand. They can also provide individualized, holistic, all-encompassing care to each of their patients, integrating the patient's own personal health beliefs. Nurse practitioners work in collaboration with physicians and other healthcare professionals to ensure the best possible healthcare for each of their patients. Nurse practitioners genuinely care about their patients, their health, their family, and the own communities where they live. Nurse practitioners teach their patients how to care for themselves when they are sick and how to stay healthy when they are well. So the last but not least thing I want to talk about is the difference between a physician assistant and a nurse practitioner. So as both you ladies mentioned, a nurse practitioner and a physician assistant are both licensed providers who are not doctors, but carry out the roles traditionally taken on by doctors, including making diagnoses, so they can diagnose, they can prescribe medications and narcotics, they can order and interpret diagnostic tests like x-rays, blood work, and they can also interpret EKGs, and they can order preventative screenings for things like asthma and cancer. The education requirements for both a physician assistant and a nurse practitioner is a master's degree, but physician's assistant's focus is more on a medical model, whereas a nurse practitioner's focus is on a nursing model, which includes a whole person and a wellness approach. Nurse practitioners have a specific population that they learn about and take certification for, whereas a physician assistant has a more generalist, broader, advanced education, and they take a generalist exam for licensing purposes. They have 2,000 hours of medical training, and they recertify every 10 years. Nurse practitioners, their program must include specific courses related to nursing, evidence-based practice, organizational skills, and they have 500 to 700 clinical hours that they must complete related to their nurse practitioner role, and their recertification is every 5 years, and they must have a current RN license. So hopefully that information has cleared up some things for you ladies about what is a nurse practitioner, what a nurse practitioner can do, and the difference between a nurse practitioner and a physician assistant. I appreciate everything about your today's visit, and you're answering the questions, and you are welcome to our AUSON YouTube channel anytime. All right, guys, you guys have a wonderful day. Be safe out there.